Yo, this is BJ Couture with Men's Health. Some people Netflix and chill. I Netflix and stretch. Here's a kneeling hip mobility sequence you can do while watching TV, the big game, whatever you got on during commercial breaks. That'll help clear up the hip capsule and also impingement in the hip so you can squat deeper and better. There's a bunch of options to choose from, mix between them, and again, you can go between them from commercial break to commercial break. First one, block the knees together. You want to get the chest up, back flat. I'm just going to start flossing my hips side to side. Now I can change, I can stay on one side and just really kind of dig in and focus on driving that thigh bone, that femur, outside the pelvis. Really we're trying to get that hip socket that can get stuck in the front and cause that impingement, put it back into the socket. And again, I can go one side at a time, floss between side to side. I can also get my hips back more to change the emphasis of the stretch and just really move in and out. Another good option is going with a knee out pattern. So get the knees out wide, and this is great for opening up the adductors in the groin, moving in and out. And one thing I'll do too, and again, we want to make sure we're doing this, I don't want to flex at my lower back. I'm trying to get motion while keeping that nice neutral lumbar spine, just a slight natural arc. I also like to go from side to side here without overly twisting. I'm trying to, movement is going to come at the upper back. If it does come at all in the hip, not the lower back, I can stand this side and kind of pump in and out. And again, this is a great way to get some more internal rotation while getting the adductors stretched out in a big way. Another great option, we go one at a time. Now I can get like this, get a 90-degree angle going, and I can kind of floss, get in and out, abduction, adduction, moving in and out there too. I can also just floss in and out of this position, trying to get that knee as close to the chest as possible without rounding and flexing that spine. Just keep that chest up, pumping in and out, and then I can really start to move, again, pushing out to the side, getting that hip capsule nice and open. I can also bias the rotation. So if I go foot in like this, I will bias external rotation in the hip, and one of the biggest issues we have with poor hip function is a lack of rotation. So that'll bias external rotation. I can go foot like that, and I can then bias internal rotation, and a lot of us are missing this in a big way, and it will mean as you squat down, your lumbar spine, or you'll tuck that tailbone too much, and that can put a tough load on that lower back area. So again, all these options work great. 2 to 5 minutes on each side, mix between the variations, find the ones that give you the most benefit and put them into your routine, and make it so that you are more productive when you're doing absolutely nothing like watching TV. We'll see you next time.